to News Daily, where we deliver the news daily. Now, they call it dying with dignity, however, it's still not legal in most states of Australia and many countries worldwide. We've received some controversial news today that 68-year-old Beverly Thompson, who lives with advanced limb-girdle muscular dystrophy, is pleading the New South Wales government to change the laws on voluntary euthanasia to allow her to legally and safely end her life. But before we get into Beverly's case, let's learn more about what euthanasia is and what the current legal environment around euthanasia in Australia is. We're going to go live to the streets of Sydney to see what the public thoughts are on Australia's euthanasia laws. Over to you, Sam.
So what do you think the laws are in Australia about voluntary euthanasia?
What's euthanasia?
Yeah, we could have explained that a bit more. Bianca, do you think you could explain to our audience what voluntary euthanasia is?
Oh yeah, we probably should have started with that. Voluntary euthanasia is ending one's life in a safe and painless manner, with their consent by a doctor administering a lethal dose of medication. It may also be referred to as physician-assisted suicide. However, there is a distinction between the two, as physician-assisted suicide is when the doctor prescribes a lethal dose of medication and the patient administers it to themselves. Does that help you?
Yeah, I guess so. What was the question?
So do you think euthanasia is legal in Australia?
Surely not.
Yeah, okay. What about you? Do you think euthanasia is legal in Australia?
Nah, yeah, mate. I remember hearing about it coming legal in the news a few months ago.
Okay, so Bianca, would you like to tell us which one of these two gentlemen is right?
Well, they're both right and wrong. In all states and territories, voluntary euthanasia is illegal and would be considered manslaughter or murder in the eyes of the law. However, just recently, in June of this year, the Victorian government made assisted dying legal, which is where a health practitioner can provide a terminally ill patient with means to end their life if they are eligible. To dive further into the legal legislation, we've got James Cordell, who is an expert in euthanasia laws around Australia. Thanks for joining us, James.
Well, thanks for having me.
So, what stops someone like Beverly Thompson living in New South Wales from just going down to Victoria and getting what she wants? What's the criteria required to be eligible for assisted dying?
Well, it's highly restricted to who is eligible or not. First of all, you have to be an Australian citizen or permanent resident and also mainly reside in Victoria. So that already excludes Beverly Thompson. You must also be 18 years or older, have decision-making capability, or be diagnosed with an incurable progressive disease that causes suffering that cannot be relieved in any other way, or expected to die within the next 6 months. Or if you have a neurodegenerative disease in which they expect to die within the next 12 months.
Wow, that is very specific.
Yes, well it has to be. There are also a number of safeguards in place during the process. The patient must take 3 separate requests, undergo at least 2 independent medical examinations, and also write a written request. Patients must also be provided with all options and information, that is, treatments, palliative care options, risks associated, and they can withdraw at any time. I'd also like to add that health practitioners have the right to refuse to participate or provide any information.
Okay, so it's definitely not an easy, quick process.
No, definitely not. Doctors have to ensure that their patient is, first of all, eligible, and second of all, is completely sure that this is what they want to do.
And how long does this process take?
Well, for the first patient to get their permit for assisted dying in Victoria, it took 26 days between application and the day of her death.
Well, I guess that's fairly good considering that they want to get the patient through as quickly as possible, but also make sure they get all the checkpoints done safely and accurately. Well, thanks for joining us, James. We've added a lot of insight to our discussion.
It's been my pleasure.
Now, Victoria isn't the first place to introduce euthanasia laws. Other countries around the world have made euthanasia legal and have differing levels of strictness. For example, in Belgium, voluntary euthanasia is legal for patients who suffer a terminal or incurable illness. Netherlands, Luxembourg, Colombia also have similar laws regarding euthanasia. Canada and also certain states in America have very similar laws to Victoria. There is one country that has quite unique laws. In Switzerland, voluntary euthanasia and assisted suicide are both illegal. However, assisted suicide is only considered illegal if it's carried out for selfish reasons, such as monetary gain. Patients do not have to be terminally ill in Switzerland either to participate in assisted suicide, so it is a common destination for people to travel to so they can end their lives if it's not legal in the country of residence, as you don't have to be from Switzerland. So it's interesting to see how different countries view this topic. Now we're going to focus on the medical side of euthanasia and musculoskeletal diseases. But before we do that, let's see what the public know. Take it away, Sam.
So what do you think of musculoskeletal disease?
What's that? Muscle disease? Does it reduce these fat gains?
So what do you think it's like having a musculoskeletal disease?
Well, a musculoskeletal disease or musculoskeletal disorder is pain or disease in the joints, ligaments,
Well,
bones.
she clearly knows. What do you think it's like having a musculoskeletal disease?
A skeletal disease? Like bones? Spooky.
Thanks, Sam. Now we've got a doctor from Victoria who is trained in assisted dying. Thanks for joining us, Dr. Nathan Deacon. Now, first of all, let's talk about the conditions that could potentially lead someone to want to apply for assisted dying.
Well, let's start with Beverly Thompson's condition. Limb-girdle muscular dystrophy is a type of musculoskeletal disease that results in the gradual diminishment of all the muscles in the body from the chin down, leaving sufferers bedbound and reliant on care. The symptoms include extreme shaking, nausea, racing pulse, sore muscles, and hyperventilation. Beverly says that she is too physically debilitated to even take her own life and does not want to risk a failed suicide attempt. Beverly just wants the option of a safe method of suicide, which is what legalized euthanasia could possibly give her.
Yeah, that makes sense. Now, we've also got another doctor from New South Wales. Dr. Thomas, what is your take on this?
Well, simply the act of telling them that it's an incurable disease may lead to dramatic consequences such as depression, severe anxiety, and studies show that the desire to prematurely die is simply rooted in depression. We found that giving patients the palliative care that they need will in fact give them a more comfortable and dignified death.
So is there really no hope for such a disease?
Well, in fact, the hope for life is already doubled without clear limits. There are constant improvements being made in all current therapeutic resources. However, we must remove the community stigma surrounding musculoskeletal diseases in general. Too often there are patients who present not just with musculoskeletal diseases, but also with many other complications. Because of the general lack of public awareness of healthcare, people who initially suffer from musculoskeletal symptoms would let their symptomatic areas fall into disuse and continue to accomplish their daily activities, leading to pain in new areas and complicating the diagnosis. By this stage, all symptoms are chronic, the patient has been misdiagnosed, they'll be given all sorts of treatment options, and everyone is just frustrated. Effective communication is key, and in this day and age, communication couldn't be easier.
Thanks for coming in, Dr. Nathan and Dr. Thomas. It's all been very interesting. Now, limb-girdle muscular dystrophy isn't the only musculoskeletal disease out there that could lead to someone wanting to have assisted dying as an option. There are many musculoskeletal disorders and some very notable and serious ones such as sclerosis. Musculoskeletal conditions are in fact the leading contributor to disability worldwide. They are the largest category of workplace injuries and are responsible for almost 30% of all workers' compensation costs. Between a fifth to a third of all people, including children, live with a painful, disabling musculoskeletal condition, and it is not getting any better. The prevalence and impact of musculoskeletal conditions is actually predicted to rise as the global population ages. So with more people living with insufferable terminal musculoskeletal diseases, other states might follow in Victoria's steps and introduce assisted dying laws. Finally, with a controversial topic like this one, we definitely do have to consider the ethics. We have best-selling author of Legalized Death, David Thomas, and mental health therapist Andrew Smith here. Thank you both for joining us. So a key question in this discussion is, does someone who is terminally ill with an incurable disease and suffering in a lot of pain have the right to choose how and when to end their life? Start off with you, David. What are your thoughts?
The extent to which the ideas of right and wrong are woven into our daily lives is complex. Our actions and beliefs are formed and defined according to an ethical foundation that is laid out when we are children, affected by many external influences, including family, friends, teachers, communities, and a variety of texts. There are no simple answers to ethical decision-making with regard to the complex issue of passive and active voluntary euthanasia. It's important to acknowledge that no one theory can systematically guide a person to such an ethical decision. The fundamental concept of ethics rests on the fact that many dilemmas and scenarios aren't simply black or white.
Now, I understand that you have a differing opinion, Andrew.
Yeah, well, for me, the mental state of a patient needs to be considered. As a society, we don't let people commit suicide. We get them help. We think that suicidal people are generally not in the right state of mind. Despite them wanting to end it all, we don't let them. Now, are people on their deathbed completely rational? Personally, I would never want to be euthanized, but I've also never been terminally diagnosed and in agony every day. So would I be in a proper state of mind to make such a large and permanent decision, even concerning my own well-being?
It is difficult to know what is right or wrong, as I do understand both your perspectives. It can be seen that euthanasia is indeed a contentious issue, with the heart of the debate centred on the medical, ethical and legal issues related to voluntary euthanasia for patients with untreatable musculoskeletal diseases. Australia's prohibition and criminalisation of the practice of euthanasia and assisted suicide reflects the legal status quo that is present in most other countries around the world. The many arguments that have been put forward for and against euthanasia, and the handful that have been outlined in this segment, provide only a glimpse into the ethical debate and controversy surrounding the topic of Australia. And that unfortunately brings us to the end of News Daily. Thanks to all our guests for coming on. I'm sure we all have a lot to think about now. We're going to leave a poll up on our website whether you think Victoria's assisted dying law should become nationwide. Let us know, and if you have any questions, please feel free to email us through.